preventive care webinar, or rather the top form. This is top form, and I'm welcoming you to this session. Please, if you can hear me and you can see me, put it in the comments that you can hear me and you can see me. If you can hear me and you can see me, put it in the comments. Say, I can hear you and I can see you. Put it in the comments. Say, I can hear you and I can't see you. You can hear me and you can see me. Please put it in the comments and say, I can hear you and I can't see you. And please take the link that brought you here and send it out to your friends so that you can bring them on here. This is the top form series, and we are getting started. If you can hear me and if you can see me clearly, if there are no hitches, please put it in the comments that there are no hitches. You can hear me and you can see me. Put it in the comments. I will be waiting for you. Put it in the comments and say, I can hear you and I can see you. Okay. All right, I can see your comments. All right, you can hear me and you can see me. So we are going to get started right away. So this is the top form series, and you are welcome to this series. Um, Over the past 2 years, just like our copy for the event said, over the past 2 years, we've been on with the preventive care webinar that has been our series. And in the course of the 2 years, we've invited different people to educate you on health, on different parts of health, on, had a dentist, we've had a fitness coach, we've had several doctors, we've had so many people come on here to educate you and teach you about health and basically preventive care, how to stay healthy, how to prevent illnesses before they come. And this time we are taking it a step higher, and we are teaching you how to be on top form, always how to be on your top form. And when we're talking about top form, we are talking about you learning to be an alchemist of health, learning to transform the resources, your time and energy and everything you have into health, into health. The same way you can go to the market and you can buy things, that is the same way the resources you have, you can transmute them, you can perform alchemy and transform them into health. And that is what this top form series is all about. And today we are going to be exploring this deeper, the general concept of preventive care, but specifically when it comes to the eye. As you can see, the caption for this season 1, episode 1 of this series, this installment, is called The Eye That See Tomorrow. It's an episode on eye health. So this is where we are starting at. This is where we're starting at, and we would like you to join us all through as we'll be going episode by episode, and let's keep educating you on your health, and let's see how to get you on your top form. We have an amazing guest with us today. She's an optometrist, and in a few minutes she'll be speaking to us. So if you have your writing materials, get them ready. If you don't have, please go and get them ready and set, because we're going to be getting into the meat of things shortly. But before I bring her on, I'm going to quickly recap the very concept of alchemy. Alchemy, because that's what we're going to be learning today, alchemy of health. So in ancient times, people were learning how to turn different materials into gold, especially lead, and that began the general idea of alchemy, how to transmit other elements into gold. But the modern philosophy of alchemy talks about and shows us how to transmute other resources, other things we have, to the things that we desire. So you can talk about how to transmit your energy, your time, or your attention into productive activity that produces money, right? So that is alchemy, for producing money. But today, you are looking at the things you can do, how to perform alchemy with the resources you already have, your time, your energy, your attention, and your time, to health, right? You can transmit your energy to health. You can transmit your time, your money, whatever resources you have, You can transmit these things to health. You can spend money to protect your health. That's preventive care. You can spend energy to protect your health. That is your exercise and the things you do. You are transmitting it. You are performing alchemy. You can spend your attention. You can spend your time. That is giving attention and awareness to the things that you need to give attention to. All of these things are the processes or the fragments of which you bring together to perform alchemy of health, transmitting all of these things into health. But today we're focusing specifically on eye health. So as we're talking about these things, this is a base mindset that you should have. This is the base mindset that you should have, that as we are doing these things, you are transmitting all of those, your resources, your time, your energy, your attention, and your money into health. And today specifically, eye health. All right. So once again, I'm going to give you the opportunity to take the link that brought you here on YouTube, the YouTube link, and put it out there. Invite people, invite your friends, invite your enemies, invite your neighbors, invite the people around you, your children, gather as a family. And as we join in this session together, the guests will be coming up shortly. Put out the link there, put it on your status, send it to different WhatsApp groups, your friends' WhatsApp groups. Invite everyone, your friends and your enemies, your exes, and everyone. Get them on here as we get started. Okay, all right. So as you're doing that, I'm going to be introducing our guest for today. Our guest for today is an optometrist. Her name is Dr. Divine Israel Chizaram, and she's going to be speaking to us on eye health today. All right, I'm going to give her the floor right now. She's going to tell us who she is, and then we are going to take it up from there. Okay, she comes up in one, two, three, and go.
Hello. Hi, Lawson. Good afternoon. Hello, everybody. Can you guys hear me? Hi, Lawson. Can you hear me? Hi, Lawson. Can you hear me? Hello. Okay. All right. Thank you. I've gotten a response that you can hear me. So I'll just proceed. My name is Dr. Divine Chizaramuba Israel. I'm an optometrist and have been practicing for the past 2 years. I'm glad to be here and be talking about preventive eye care. So yeah, I'm proceeding now, if that's fine. So can we get the slide on, Mr. Lawson? Hi, Mr. Lawson. Can we get the slide on so we can start? All right, thank you very much. So yes, my name is Dr. Israel Divine Chizaram. I'm an optometrist with a passion for preventive eye health, community eye care, and also public health education. Okay, so let's proceed now. Okay, we are proceeding to slide 2 so that we can begin properly. Hi, Mr. Lawson, are you here? Okay, so we are starting now. Once again, our topic is preventive eye care, which is protecting your vision for life. So now, why eye health matters. Number one, about 80% of blindness can be prevented with proper eye care. That's for sure. Number two, vision impacts learning, productivity, independence, and quality of life. So if you cannot see, you won't be able to be productive. And also number three, there has been a serious rising cases of digital eye strain and lifestyle related issue. So this is why this webinar is very, very important. So like he earlier said, if you can, please share the link and also let people be aware that this is currently ongoing because it is very important. So let's proceed now. Now, we're talking about some common eye conditions. We'll be looking at different eye conditions. Number one, we have refractive error. This is what most people have because it can be corrected with glasses or contact lens. There are different type of refractive error. We'll be diving into it now. So let's proceed. So one common eye condition is what we call refractive errors, which has different type. There are different types of refractive error. There are different refractive errors. So we'll be looking into the different types of refractive error now. So different types of refractive errors. We have myopia, which is also known as nearsightedness. It makes distant objects appear blurry while nearby objects are clear. So when somebody is saying, "Oh, I cannot see from far," or your child comes back from school and be like, "Ah, mommy, I cannot see from my seat. I can't see what the teacher is teaching," or your child's teacher is complaining that, "Oh, she's not very active in class." It could be as a result of myopia because the child is not seeing what the teacher is writing from that distance. So we have hyperopia. It's opposite of myopia, which is people with hyperopia, they can see distant objects more clearly than nearby objects. So it's just the opposite of myopia. Then we have astigmatism, which happens due to an irregular shaped cornea and distorted vision or blood vision. Yes, so you can have myopia and astigmatism, you can have hyperopia and astigmatism, and you can have just astigmatism. So we have presbyopia. Presbyopia is an age-related refractive error that affects the eye's ability to focus on nearby objects. So you see some patients or some elderly patients when they want to read, they tend to move their print backwards, like forward rather, so they can be able to see. That's what we call presbyopia. Is age-related. It's usually from patients above 40, but it can happen earlier. It can happen later. So let's move forward now. So now this is a pictorial um this is what a normal vision should be. The first one is a picture of what a normal vision should look like. Is the first one. And a myopic vision, if you can see, you are seeing that afar that tree that was clear for a myopic patient, you're seeing it blurry. Then for hyperopic vision, you see that it's very clear at far, the trees very clear at far, but the grass now is now blurry. And that's because for myopia, you cannot see very well at far, but you can see at near. Then for hyperopia, you can see very well at far, but you cannot see very well at near. So this is just like a picture of what it looks like. So let's move forward. Now, vision with astigmatism. Yes. So this is what an astigmatic vision looks like. You see the lights, you're seeing lights as streaks or halo. Then difficulty seeing at night and also blurry vision. This is what patients with astigmatism they usually complain that, "Oh doc, my light, if I'm driving when the light is coming is either bent or it's just wavy and the rest of it, and I'm seeing double vision or I'm bumping into things, or these are just this is what a patient with astigmatism would see." So let's move on. Also again, vision with astigmatism, you see the normal vision, you see the lights, you see how it is stable, but that of astigmatism, you see how it's flashing the halos of light. Then example two, vision with astigmatism, you see that it's double. Then the one with normal is blur, rather it's blurred. Then the one with normal vision is very clear. So yes, let's move on. This is what a patient with astigmatism would usually complain of or see. Then for presbyopia, you see the way the man is taking the prints back, or the print is normal and then he's moving his head backwards so that he'll be able to see clearly. This is what presbyopia can do. You cannot focus properly when you are at the normal range, you tend to take it backwards. So that is a vision with that's presbyopic vision. This is the sign and the symptoms. So let's move forward. So number two, so we are done with refractive error now, where we talk about myopia, hyperopia, astigmatism, and presbyopia. Okay, thank you, Mr. Lawson. Yeah, good to know that you can see and hear me. So we are moving forward now. We are done with refractive error. Now we are moving to cataracts. This is a very common eye condition, especially in Africa. Especially in Africa. So what is cataract? It is the clouding of the eye's natural lens. It causes blurred vision or dim vision. That is what cataract is. Now the treatment is only sorry, the treatment only effective option is surgery to replace the cloudy lens or with a clear artificial one. Sorry. So what this means is that the only treatment for cataract is surgery. You will see some patients, their eyes are white, like most of them. Their eyes are like white. You are seeing like a whitish thing. If it's not like a normal condition, let's say the person was born with it and the rest of it, you see that their eyes are white. So the lens that is supposed to be transparent is now white. Now the only treatment of this is surgery, where we are removing that natural lens and then we are putting an artificial one. So that is what cataract is. Symptoms of cataract would be blurry vision and the rest. So let's move on so that I can show you what a normal eye see and what a patient with cataract would see. Okay, so this is it here. The normal eye will see this beautiful flower as being clear, and this is what a cataract vision is. You see how blurry it is. So this is it. So if you have this complaint, it could be as a result of cataract. So let's move on. Now we have glaucoma. It's also called the silent thief of sight. This is a very common eye condition also. Now, glaucoma is the damage to the optic nerve. It is also linked to high eye pressure. It is usually painless until late stages. Management are eye drops, laser or surgery to lower eye pressure and prevent further damage. So I'll just take some time to explain glaucoma because it's actually a very common eye condition, and we are raising serious awareness so that we can tackle glaucoma at its early stage. So glaucoma does not really have a treatment. We can only manage glaucoma. Now, what this means is that if you come in as a patient, if you have glaucoma and you come in at the late phase of it, we can do little or nothing about your vision. So any vision that you've lost from glaucoma cannot be recovered. So what we do if you have glaucoma and it has resulted to loss of some certain part of your vision, we just preserve the remaining one. So now it is asymptomatic. It means that it does not have any symptom, especially at the early stage. So glaucoma takes the peripheral vision gradually until it comes to the center and then it becomes a tunnel vision. So now you're not really noticing it, because if you want to pick something by your right, you don't necessarily have to just move your eye. You just turn your head. So that's why glaucoma is you don't even notice any symptom, because you are seeing very well until maybe later you can realize that, oh, I'm not seeing very well, my side vision is bad, maybe I'm not like, or when it has now become like a tunnel vision. But you can avoid all this if you regularly visit your optometrist. Then you can be able to know if you have glaucoma. We run some tests for you, the OCT test to check your eye pressure. With that, to be able to know if you have glaucoma or if you don't, and if you do, to what level that you have glaucoma. You'll be able to handle it from there. So glaucoma is a very common eye disease, especially again in Africa. So we advise people to come to the hospital, come and get your eyes tested for glaucoma. Come for glaucoma screening. So let's move on. So this is a pictorial um, vision of glaucoma patients. Now the normal vision, this is normal vision. You see how it is, everywhere is, you are seeing clearly. Now the early stage of glaucoma, are you seeing how it is gradually taking the peripheral vision? like the side is no longer clear. You can only see like that middle part. Now there's a moderate stage. You see that it has gone deeper again to the peripheral part. It's taking the peripheral vision, and then this is the advanced stage where it becomes a tunnel vision. That's what we call it. It's now a tunnel vision. So you just can see just from the central part of your eye. You cannot see your peripheral side again. And at this stage, it is like the advanced stage. And honestly, there's nothing that we can do currently as of today. There is nothing we can do about that vision. We can only preserve what you have left, what you have left, which is the central vision. But once you've lost that vision from glaucoma, it can almost not be recovered unless there's a treatment that comes up later. But as of now, there is no treatment, and then any vision you've lost from glaucoma, you cannot recover it. So let's move on. So number four. So number one, we had refractive error. Number two, we had cataract. Number three, we had glaucoma. Now we have diabetic retinopathy. As the name implies, it is commonly found in patients that have diabetes. Like you have a systemic disease which is called diabetes. So now, what is diabetic retinopathy? It is the damage to the blood vessel in the retina, and it is caused by uncontrolled diabetes. Treatment is blood sugar control, laser therapy, or injection to protect and preserve the vision. So if you have diabetes and it is not under control, you can come down with diabetic retinopathy. So the treatment currently now for this is control your blood sugar, your blood pressure, and the rest of it. And also we have laser, we have injection to protect and preserve vision. So what I said earlier of glaucoma, we are preserving whatever you have left. So that is it. So if you have diabetes, please always visit your GP, your doctor, so that you can keep that in check. Let's move on now. Let's see patient with diabetic retinopathy. Okay, so this is the normal. The first image is the perfectly normal eye. The second image is now blurry. So that is like symptoms of diabetic retinopathy. We have blur vision. It occurs at the early stage of diabetic retinopathy. So you see that blurry vision can be is a symptom of like so many eye disease. So we cannot just ask your doctor, oh doctor, I'm having like blurry vision. What can I take? You have to come to the eye clinic so that we can know exactly the cause of that blurry vision. Now, the last picture there, at this stage, the retina and the vitreous area have been affected, and dark spots can be seen floating in vision. So you see patients, they are telling you that, oh, I'm seeing like there's dots, like in my eyes. Like I'm seeing, like I saw a patient yesterday, and he said, I'm seeing like there's insects, but I can't catch them. They're just moving. So that's like one of the sign of diabetic retinopathy, where you are seeing dark spots, you're seeing floaters. So let's look at another image of what a diabetic retinopathy patient sees. So this is his normal vision is here, and then for a diabetic retinopathy patient, you can see the dots, you can see the central vision there, you can see the dots. So that's what we call it floaters. So if you have this symptom now, you should visit your optometrist and also keep your sugar in check. So let's move on. So number five, we have age-related macular degeneration, which is called AMD. It is a gradual image to the central part of the retina called the macula, leading to loss of sharp and central vision. Now the treatment is lifestyle changes. You quit smoking, you eat healthy, you exercise, you wear sunglasses. We also have injection or supplements in certain types to slow progression. So most of this eye disease is if you've lost a vision, it takes it's not so easy to recover it back. You can get it back for some of them, but it is not so easy. So what we do in the treatment or in the management is we just slow the progression, or we preserve the vision that you have left. So let's see what a patient with this AMD would see. Okay, so these are the stages of AMD. The normal, you can see the beautiful girl, you're seeing her clearly. Then the early sign, we see that her face, the central part, which is the face there, is blurry now. the other side, you can still see that it maintains the same vision, the same light and everything, but the center part is blurry. Then the moderate, intermediate, you see it's getting dark, and the rest, then you can see the advanced. At this point now, the person is no longer seeing. You see where your grandparents is not seeing their grandchild, or you know that, you see, it's just gone. The central vision is just gone at that point. So once again, it is important that you visit your optometrist. So let's move forward. Okay, this is another pictorial chart of a patient with AMD. You can see the normal beautiful young boy. So you see the middle. This is how you see your grandchild. So if you see your grandchild like this, it is not normal. You should actually visit the optometrist, and it's age related. So that is why we had to put like grandchild. So that is the late vision loss. Then another symptoms or sign of it is called distortion, where things are bent, you're not seeing straight. So if you have these symptoms, please visit your eye doctor. So we can move forward. So we have warnings and red flags. If you see or if you have any of these, please do visit your optometrist. General signs: we have blurry vision or double vision. If you were here when I started, I spoke about blurry vision being one of like the most common symptoms of eye conditions. Then if you have difficulty seeing at night, it's not normal. If you are sensitive to light, yeah, please visit your optometrist. If you have eye pain, you have redness, you have discharge, those things are not normal. Please visit your optometrist. Then if you have frequent headaches with eye strain, maybe if you use your eye, if you read for long, or your um you do so many you do you have like a long period of eye work, maybe on your screen or something, and you come down with eye strain frequently. It can happen once in a while. Maybe you're on your system for a very long time. When you rest, you can get yourself. But if this is frequently happening, the headache, the eye strain is not normal, please do well to visit your optometrist. So we can move on. So these are emergency red flags. These are something that you should not even you shouldn't have a double mind, like you just have to visit like immediately. So number one, we have sudden vision loss or blurring. It just happens that suddenly you just cannot see, then number two, we have flashes of light or many floaters. So if you're seeing floaters, just like the diabetic retinopathy sign that we saw, do well to visit us. Then you have cutting like shadow across vision. You're seeing like cobwebs, or you're seeing like cutting. You're seeing like insects are flying across your eyes, but you can't catch them. It's not normal. That's not normal vision. And you have severe eye pain. Please do well to visit your optometrist if you have any of these red flags. So yeah, we can move on. So we are moving on now. Yes, thank you. I'm moving on to the risk factor for eye disease. Number one, we have age. So what this means is things that if you have or you are doing, you are more at risk of having some eye disease. Number one is age. This is the biggest risk factor for many eye disease, including cataract, glaucoma, and AMD. They are common in people over 40 years and above. Then aging naturally causes lens changes, weaker tear film, and retinal wall. So just like the way you have white beards when you are aging, your eyes are not also as sharp or normal as it were when you were younger. So if you're 40 years and above, please do well to always visit your optometrist, because that's like one of the biggest risk factor. You have patients with glaucoma, cataract, and AMD, just like the name implies, age-related macular degeneration. So, if you're above 40, please always make it a point of duty to visit us at least once a month, twice a month. Just keep coming to the optometrist until we tell you that, okay, we give you come back in 6 months, come back in 3 months. But for now, just keep coming. Then let's move on to the next one. So the second risk factor we have is family history. So genetic plays a major role in conditions like glaucoma, AMD, and keratoconus. If a close relative has an eye disease, the individual's risk is higher. So what this means is that if you have any family history of glaucoma, if you have any family history of cataract, AMD, yes, your risk is higher, especially for glaucoma. So if you come to the clinic and say, oh, I'm not seeing as far. I want glasses. I'm myopic or whatever. And I'm tracking you. I'm taking case history, and I ask you, do you have any family history of glaucoma? You say yes. Oh, maybe my mom has glaucoma or my dad has glaucoma. We just immediately advise you to go for glaucoma screening because the risks are higher. So if anybody from your family, maybe they were blind before they died, or you were aware, or you are aware that they currently have certain diseases like glaucoma, or they are complaining that they are not seeing very well, just you just have to keep coming to the optometrist visits, come for glaucoma tests if you know that your parents have glaucoma, or somebody in your family, extended family, your grandparents or whatever. And if you don't know, you also need to come so that you'll be aware, you know your status, and know if you have glaucoma. As a parent, if you know that you have glaucoma, please bring your children for eye screening, no matter how young they are, no matter how old they are. 10 years, 15 years, they can have glaucoma. They do have glaucoma. So if you know you have glaucoma as a father, as a mother, or your parents had glaucoma, please, please, please do well to bring your children to the eye clinic so that you can get tested for glaucoma. So we are moving on now. So we are moving on to the third risk factor for eye disease. We have diabetics and hypertension. Diabetes damages retinal blood vessel if not properly managed, which can lead to diabetic retinopathy. We just spoke about that. And then high blood pressure can strain small vessels in the retina, which causes vision loss. Both conditions can speed up cataract. So self-explanatory. If you have diabetes, you have hypertension, you have your blood sugar is high, your blood pressure is high, and it's not under control, it can actually cause damage to the eye. For diabetic, it leads to diabetic retinopathy. For hypertension, it leads to what we call hypertensive retinopathy, and both of them can cause vision loss if not properly managed. Secondly, they can also cause cataract. They can speed up the progression of cataract. So if you have any of this systemic disease, do well to visit your practitioner, your doctor always, so that you can keep it in check. So we are moving on to the next one. So the next risk factor for eye disease, we have smoking and alcohol. Yes, so smoking increases the risk of cataract and AMD by reducing blood and oxygen supply to the eyes, while alcohol abuse may worsen nutritional deficiency that affects the eyes. So it's self-explanatory. If you're a chronic smoker, if you're a smoker, or you take alcohol, yes, I'm just letting you know that it can increase the risk of having cataract and AMD by reducing the blood and oxygen supply to the eye. So please do well to stop it. Now, the next one, the next risk factor for eye disease. These are things that if you do or you have, you are at risk of having eye disease. Number four, we have prolonged screen use. Almost all of us are guilty of this one, but it causes digital eye strain, causes dryness, causes headache, it causes blurry vision. And then in children, too much screen time without break can increase myopia progression. And yes, so if you use screen time a lot, we advise you to take breaks. There's something we call the 2020 rule. If you use when you use your system for, or you do near work for 20 minutes, you take 20 seconds to look at a distance of 20 feet. So just just do this so that it doesn't cause the digital eye strain. Symptoms can include dryness. You're complaining of maybe your eyes, you're feeling like sand is inside your eyes, headache, blurry vision. And then for children, please, if you're a parent here or you have a younger one, or people that uses screen time, that uses screen a lot, especially children, please do well to have breaks in between, and also try to take them out. Let them go out, let them see, like, experience nature once in a while. You take your children out. They don't always have to be inside on screen, because it can really increase the cause of myopia. And um myopia prolonged myopia can actually cause more damage, like later on in life. So please take your children out. Make sure to let them see nature, let them do something else, let them do something that would expose their eyes to distance, and no longer, like, screen and the rest. So yes, let's move on. Okay, so we have a question here. Okay, probably we'll take the question after this section so that Okay, number five, we have UV light exposure increases the risk of cataract, pterygium, and macular degeneration. Not using safety goggles can cause preventable injuries at work, sports, or other chemicals. So I'll take it again. The UV light exposure is the light that comes from the sun. Yes. It increases the risk of cataract, pterygium, and macular degeneration. I don't know if you've seen people that you see something like growing from one side of their eye, one I don't know how to explain it, but maybe you've seen people like that. That's what we call pterygium, and it can be taken out only through surgery. We do pterygium excision. So what causes that more often is UV light exposure. So exposure to sunlight. After a while, if you're really exposed to sunlight, it causes you're at risk of having cataract, pterygium, and macular degeneration faster. And also, if you work in a place or at a company organization that uses chemical a lot, please do well to wear your safety goggles. If you are into sports and your sports require safety goggles, please do well to wear it if you're at work, anywhere you are, and your work requires safety goggle and you're giving one, please do well to wear one. If you're not giving one, try and get one because it's for your own good. So let's move on. Okay, so we are done with risk factor now. We are moving into healthy lifestyle for healthy eyes. Number one is nutrition, foods rich in vitamin A, C, E, zinc, omega 3, etc. So we have different food that are rich in vitamin A. We have carrots in vitamin E. We have almonds in vitamin C. We have orange, vitamin lutein. We have corn, omega 3. We have fish. Just eat healthy, and be specific or be intentional about your nutrients and the food that you eat. So let's move forward on healthy lifestyle for healthy eyes. So hydration, drinking enough water helps maintain tear film and reduce dryness. As you can see, our baby here is giving a thumbs up to drinking water. Please do well to drink water a lot. It helps a lot. It reduces dryness and helps to maintain the tear film. So please drink water enough for healthy lifestyle to have a very healthy eye. We are moving on to the next one. Moving on to the next healthy lifestyle for healthy eyes. We have exercise. Exercise, very important. It improves blood circulation. It supports oxygen delivery to the eye. So please do well to exercise if you can. Make it a routine. Let's move forward. Let's move forward. We have adequate sleep. Adequate sleep, it gives eye time to rest, it reduces strain and dryness. So please do well to sleep very well, rest. If you come back from work or whatever, just rest. Find time to rest. Find time to allow your eye rest and sleep very well. So we are moving on to the next healthy lifestyle for healthy eyes. We're moving on to the next healthy lifestyle for, we've not gotten to the eye strain prevention. Moving on to the next healthy lifestyle. Okay, so it is actually smoking cessation. Stop smoking, quit smoking. Because like I said earlier, it increases the risk of cataracts, AMD, and poor ocular blood flow. So when you stop smoking, you reduce that risk of having cataracts, AMD. When I say AMD, I mean the macular, age-related macular degeneration, and also poor ocular blood flow. So you're moving on now. I'm moving on now to digital eye strain prevention. Thank you very much. Like you said, like the name implies, digital eye strain. So what it means is that it's the eye strain that comes from the use of gadgets and all those stuff. So how to prevent it? Number one, follow 2020 rule. I said it earlier on. For every 20 minutes, look 20 feet away for 20 seconds. So I'll take it again. After 20 minutes of using your gadgets, whatever, you look at a 20 feet away. So you just remove your eyes and look at something 20 feet away for 20 seconds. You might not really know how to calculate 20 feet away, but after 20 minutes of using your system, just look around. Don't look something that is very close to you. Look around. You can walk around for 20 seconds and then you come back and continue. It prevents or reduces the eye strain that comes from using our gadgets. So we are moving on. Moving on now to number two, use proper lighting and posture to reduce glare and reflection. You're working on your system, please use the normal proper lighting and posture. I think um there's a normal one. I think it should be in the next slide. So let's check it. Okay, so this is it. You keep your screen distance 20 to 24 inches from your eye, which can also be measured to 50 to 60 centimeter. Yes, exactly. So use proper distance and also posture when you're using your gadgets. Also, like the picture here, we have like how to prevent computer vision syndrome. Number one, 2020 rule, just like I said. Number two, larger text size. You can increase your text size, your font size. Please do that. Artificial tears, this is an eye drop. It's called like lubricant. It just helps to lubricate the eye. More frequent blinking, blink a lot very well. If you're using your system, you're pressing your phone, try to blink, try to rest. Number, we have eye checking, which is visiting your optometrist, check your eye very well. Healthy food, just like I said, maintaining distance, we just talked about it, your posture, and then the distance from your gadgets to your eyes. Eye exercising, you move your eye. That's all eye exercising is, move your eye, like when looking at your central vision, you just move your eyes and all that. Proper light level, don't work in a dim environment and the rest. Then blue light filter, that's the blue cut lenses. I think we have that in the next slide, so we can move to the next slide. Okay, so we have blue the use of blue light filters or anti-reflective lenses. So just like the name implies, blue light filters. So what it does is that the rays of light that comes from our gadgets to the eyes, by the time you use these blue cut lenses, it blocks that rays of light from um, entering the eye. Just like we have the UV rays of light that comes from the sun, we also have the one that comes from our gadgets. So when you're using these blue lights or blue cut lenses, it prevents that light from entering the eyes, and then it can also it will prevent digital eye strain. Then we also have use of sunglasses with UV protection. When you're going out under the sun, please do wear sunglasses, because constant exposure to UV rays of light can cause or can increase pterygium, the rate of pterygium and cataract. So we are moving on now to the next one. So wear safety goggles when handling chemical, during construction or sport. Like I said earlier, if you work in a place or at an organization that you would need safety goggles and you're giving one, please wear it. If you're not giving one, please do well to get one. If you're a sports person and then your sport requires safety goggles, please do well to get one. Okay. So we have moved now. We are done with the strain, digital eye strain. We are now at the eye protection at home and work. So we are done with that one. We are moving on now to the next one. Yes, avoid rubbing your eyes. It preserves surface integrity. So, like the picture say, please don't rub your eyes. Avoid it by all means, because we have so many bacteria germs now, and you're using it to rub your eye. No, no, no. Please don't rub your eye. So we are moving on to the next one. Practice proper contact lens hygiene. So contact lens is a lens that is worn on top here. It can be medicated. So if you don't want to wear glasses, you can put your prescription in the contact lens and then you use it, and all that. So clean, store, and replace as advised. I just added a picture here. So I'm just going to like be reading it just a rundown. Number one, properly clean your contact lens. Number two, handle your lenses with clean hands. Number three, keep your lenses away from water. It is a solution that will be given to you if you have a contact lens, especially medicated one. Even if it's not medicated, when you buy contact lens, you're advised to get a solution. So you put it inside the solution when you're done using it for the day. Don't use water because water is a bad influence on contact lens. Then don't sleep on your contact lens. Please do not sleep on them. You can keep them next to you. Always keep your contact lens case clean with fresh solution. So the solution you can, when you're done with that one, you can throw it away. You put another one. So always do that. Keep it clean. Then replace your case at least every 3 months. The cases of the contact lens, replace them after every 3 months. Yes. So we are done with this. We are moving on to the next one. Okay, so regular eye checkups. When should you check your eye? For children, before school resumption, every time your children are going back to school, always check their eye because they might not always come and complain to you that, oh, mommy, I'm not seeing well at far. You understand? Maybe their teachers, if they are really bright students, their teachers can notice that, oh, your child is not doing so well this term. And when you ask the child, it says, because I'm not seeing from my seat, I cannot see. And maybe they don't know how to speak up and the rest. So when you bring them to the eye clinic before school resumption, we check how well they're seeing at far and at near. So please bring them before school resumption every term. And for adults, you visit your hospital, your eye doctor, your optometrist every 6 months. Very advisable. Then, if you are diabetic or you have a risk of glaucoma, somebody in your family has glaucoma, or you yourself you have glaucoma, you have hypertension, you are supposed to come frequent, like you visit often. You visit often. So we are moving on to the next one. Okay, so just here, early detection is key to preventing irreversible damage. So if you detect your eye condition early enough, you just prevent yourself from having irreversible damage, which means visit your optometrist frequently so that we can detect this early. So we are moving on. Okay, yeah, so the same thing I said, visit the optometrist frequently. Optometrists are your eye doctor. That's what it means. We are the eye doctors. So visit us frequently, regularly. Always visit your optometrist regularly. Yeah, I'm moving on to the next one. Okay, so we're moving on to myth and facts. Number one is wearing glasses weaken your eyes. I've gotten that a lot. I cannot even like count how many people have said, oh doc, I don't want to wear glasses. They said if I wear glasses, I'm damaging my eye or my eyes. Nah, that's not true. Glasses are like it. The way you can walk on barefoot and go outside, but you choose to wear slippers, choose to wear sandals. That's the way glasses are. It's just aid, yeah, aiding you. It cannot weaken. If for anything, it even helps you see better. So why would you weaken your eye? So that is a myth. Number two, we have eye drops cure cataracts. That is not true. Eye drop does not cure cataracts. The only treatment for cataracts is through surgery. Eye drop does not cure cataracts. If you see anybody online telling you, oh, come and buy this eye drop or come and buy this one to cure your cataract, to cure your glaucoma, that is not true. Eye drops doesn't cure cataracts. Just surgery. Surgery alone can cure or can treat cataracts because you are removing the lens that God gave you and we're putting in artificial one. So eye drop cannot do that. Carrot alone fix vision. That is not true. Carrot is good for the eyes, but it doesn't fix vision alone. I've heard it a lot also because we know that the number one food if you want healthy eye is carrots. So yeah, it doesn't fix your vision. It is healthy, it is good for your eyes, but that alone cannot fix your vision. The fact is that balanced diet, protective habits, and regular examination helps to maintain vision. So no carrots, balanced diet actually. So we are moving on to the next one. So wow, conclusion. The key message is most vision loss is preventable with awareness, protective habits, and regular care. I'll take it again. Most vision loss is preventable with awareness, protective habits, and regular care. This is why this webinar is coming up now, because we are creating awareness. We're teaching you how to protect your eyes. We're teaching you how to care for your eyes. And if you do this, you also visit your optometrist, you would see that the rate of vision loss would drastically reduce, and you prevent it in future if you're supposed to have one. And then your eyes are for life. Protect them today. Your eyes are for life, like forever and ever and ever. I don't think that you'll be so how do I put it? Okay, I don't want to say some stuff here that would be mean or sound somehow, but yes, your eyes are for life. But if you have one, please do well to protect it. I've seen cases of low vision, I've seen blind cases, and trust me, they'll give anything to see, they'll give anything to have your eyes. So you have one, please do well to protect it, because without your eyes, like I said, I don't want to say anything that will be so mean. So thank you very much. I think we have come to the end of this section. We are now open for questions. I am now open for questions and discussion. So if you have any questions, do not to drop it on the comment section and I will answer them. Thank you so much for listening and for your time. Thank you. Thank you very much.
All right. I think that was an awesome one. That was really an awesome session there, Doc. I personally learned a lot of things, and I believe our audience have learned so much also. Thank you so much for this session. All right. So right about now, I think we're going to be entering into the questions. I'm going to be putting them up on the screen. I'm going to put them up on the screen so that you can respond to the questions. There are a lot of questions here, a lot of comments. I just asked them to wait. The questions will be taken at the end of the session. So I'll quickly fire away.
Okay. Okay, Julian is asking, please, can too much shedding of tears cause blindness? Definitely not. Too much shedding of tears cannot cause blindness. It can actually be a sign or a symptom of an eye condition. For example, dry eyes, the strain from your gadget. That's what we call digital strain. Yes, so it can be a symptom or sign of another eye condition, or like an eye defect, but it cannot cause blindness. No, it cannot cause blindness. Doc, Jubilee is asking, Doc, where can I buy original blue ray protection glasses? Okay, so the truth is that you can buy. I think people that sell frames of glasses, they have one that just have a coating. Exactly, it's not like the blue cuts. They just have like this small coating. Yes, but if you want to get like very good and certified blue cut or blue ray protection glasses, then I'll advise you to visit your optometrist after your refraction or whatever. Then we take your prescription and we give it to the optician. So yeah, it's from the optician that you can buy your blue ray protection glasses. But we advise you to see optometrist first to know if yours would have any power in it, or it's just the plano. When I mean plano, it means like no power, nothing. It's just to protect your eyes from the sun and from your the light that comes from your gadget. So the answer is optometrist and also your optician. Oh, Sandra is saying this doc is fine. Teaching good. Oh, thank you very much. Thank you very much. Sandra is also asking, Doc, are contact lenses really safe? I want to slay this Christmas. So, Doc. Okay, Sandra. So, contact lenses are safe if you know how to, if you know how to, let's say, manage them, or if you know how to care for them. Exactly. If you know how to care for them, contact lenses are safe. So I don't know if we are able to get this slide after this section, because I wrote down some stuff on how we can care for our contact lens. Like I said, don't sleep on them. Always change your casing. Always use solution. Don't use water. So if you know how to care for your contact lenses, then you are good to go. You are safe. Emmanuel is saying, "Wow, I'm learning a lot of." Oh, thank you so much, Emmanuel. Thank you for listening. He's also saying this is the lifesaver.com. Oh, thank you so much. Thank you so much. This is why we have this webinar, so that we can learn and also protect our eyes. Julian is saying, "Ma, please, can someone at their early 30s develop cataract?" Yes, you can. So cataract can also come from, let's say, trauma. I had a patient yesterday that came in for surgery. I think 10 years old. I think he had an accident or he had trauma to the eyes, and then it resulted to cataract. So we call that one trauma-induced cataract. And we also have congenital cataract. That one is from birth. Probably the mother had it or has it, the father has it, or somebody in the family just has it. Um, so the child is born with that one. So you can see that even a newborn baby can have cataracts. Somebody growing up, maybe accident or punch in the eye, trauma, whatsoever, it can lead to cataract also. So yes, somebody in their early 30s can develop cataracts. That's a yes. So Emmanuel is saying, "Doc, please elaborate more on this family thing. Both parents had eye issues. I don't want any of those horrors." Okay, so if your both parents have or had eye issues and they wear glasses or not, it's advisable that you come to the optometrist, come to your eye doctor, so that we can check your eyes, we can run tests on your eyes, glaucoma screen, and all those things. We might not be able to give you solutions as to why you will not wear glasses, but we can check if you actually do need the glasses. We give it to you. If you don't, we let you know. We'll tell you some other things that you'll be doing, so you can have good vision. But if your both parents have glaucoma or cataract or AMD, please visit the optometrist. Okay, Emmanuel is saying, the screen time thing, all of us." So, like I said when I started, we are all guilty of it. I've been here for more than 20 minutes, and trust me, I've not moved my eyes away for 20 seconds. I've tried to do it once or twice, but I've not been so consistent in 20 minutes time. So, like I always advise my patients, you might not always be so on track. You can have a meeting that will last for an hour. You can have a presentation just like as we're having now, but be conscious that you are not supposed to always be focused on your screen. After some time, you just move your eyes away. I've done it like 5 or 6 times when we started this whole session. Just be conscious enough to just remove your eyes. Just look around, look at your surroundings. Do all that stuff, and then you come back. It will actually help. And also the blue cut, very very important. I do have my own. I think I was rushing, so I forgot to put it on. So it's very important that we get and use the blue cut. It might not really have any power. It can just be plano, but you just wear it when you want to use your screen. Like mine doesn't have any power. I just wear it when I want to use my screen, and all that. So if we are able to do this, don't worry, we'll not go blind. Okay, so Sandra is asking, Doc, how do we stay safe from all these supplements? What's right or wrong to take? So we have supplements for the eyes. They are called eye antioxidant. So it combines all the supplement that you need inside. You take it. But right now, we are seeing so much or so many false information on the internet going, vision tea, you take this, it will cure this. Trust me, it's a no. We are currently working on bringing those stuffs down, and that's why we are interested in awareness like this, because it doesn't work. Come to the clinic, visit your optometrist, we give you supplement. We have antioxidant, just like the way you have blood tonic and all those stuff. The eye also has like its own supplements where it has different nutrients, it has vitamin C, omega 3, all those stuff. Yes, so but you can also buy like these supplements just Each different. You can buy omega 3. You can buy supplement that has vitamin C. You can take vitamin C. You can have buy supplement that has other eye nutrients, those things that we need for our eye. You can buy supplement like that, vitamin A, vitamin E, and just take it if you can. Or you can buy one that has all of them inside it. But the ones that is currently going online, if you take it, you mix it inside your tea, you go, no, that is not right. It is wrong. Julian is saying thank you so much, ma. Thank you, Julian, for listening and also asking your questions. Sandra is saying thank you so much, Dr. Sandra. Thank you so much for listening and asking questions. You made it more informative. Jubilee, thank you for the fire. I'm so grateful. Thank you so much. Ima, thank you once again. This is the lifesaver, doc. Thank you. Thank you for participating also.
All right, all right. I think there are no more questions. I can't see any other questions in the comment section. Please, if you have any more questions, just put it in the comment section in the few minutes left for us to wrap this up and call this a day. And meanwhile, Doc, this session has been nothing short of amazing. I've personally learned a lot, and I believe our audience have also learned so many things. And I think it gives us more direction now how to care for our eyes and, make better decisions and do make better choices subsequently. So thank you so much for taking out the time to participate in this and teach us. And like the audience says, I think one person says you are teaching good. So yeah, you are teaching good.
I say thank you. Thank you for up and also inviting.
All right. So while we are waiting for any other questions, please, for those of you that would like to connect with the doctor, ask questions or book an appointment, or connect with her on her socials, please, Dr. Divine, where can they find you? How do we connect with you? How do they stay in touch with you? What you are doing or book an appointment? How do they do that?
Sorry, I didn't know I was on mute. So I said I can drop my Facebook handle here and my LinkedIn. I'm active on those social media platform, and I can also drop my business line maybe in the comment section, or I don't know how I can get it across to you, Mr. Lawson. What do you suggest? Should I just type it out here, or I send it to you and then you send it? Sorry, I cannot hear you.
Okay, I said you can just put it here in the comments, then I'll put it on the screen so that they can copy it or check it out immediately.
Alright, so I'll do that.
All right.
Um,
All right. So as you can see on the screen, that is her Facebook handle. On Facebook, it is Divine C Israel. Just go on Facebook and search Divine C Israel. You can connect with Dr. Divine there, and you can reach out to her. Just send her a DM, and she's going to reply you. And then you can ask your questions, and then probably book an appointment. Let me put on the LinkedIn,
Okay.
the LinkedIn handle also. All right, and then that is her official number. You can reach out to her. Doc, should they call you or send you a WhatsApp message? Which one?
The WhatsApp message is better.
A WhatsApp message is better. All right, so there you have it. Her Facebook handle is this, Divine C Israel, and then that's her number. You can copy it, you can put it down, so you can send her a WhatsApp message. She said, preferably a WhatsApp message. So there you have it. Today's section has been a successful one, and we're going to end just like we started. We're going to end just like we started, the alchemy of health. That you have your time, you have resources, you have your energy, and you have your attention. These are all resources at your disposal, and you can transmute any of this into health. You can use your energy to exercise, just like she said. She talked about exercising. You can use your money to pay for preventive care services. You can use your attention to, you can pay attention to the things concerning your health. You can become very much aware of the things that are necessary for you to be healthy. So all of these things are the same things you transmute into health. You are performing alchemy. You are performing alchemy. So I believe you've learned a lot from this session, and you will go out there and become an alchemist of health. That is what this top form series is all about. That is what this series is all about, for you to stay in your top form. And today, you have learned live how to get your eye on top form. You've learned the risk factors, things you should avoid, and the things you should do. So go out there and get your eye on top form. And episode after episode, we are going to keep helping you to get on top form for different aspects of your health. So you go out there and make the rest of your life the best of your life. Thank you so much, Dr. Israel. Thank you so much for being on here with us. Uh,
Thank you.
yeah, and I'm sure the audience are very much appreciative, as evident in their comments to you. So thank you so much.
Okay, thank you for having me here. Thank you. You're welcome.
All right.